She is a pediatric surgeon at the National Hospital Abuja. We're excited to have you in the studio this morning.
Good morning, Dr. Salamatu. Thank you so much for joining us to discuss this particular issue. So can you provide an overview, of the current state of cleft treatment in Nigeria?
Okay, good morning, and thank you for having me. It's a pleasure. Cleft lip and palate is a congenital anomaly that is seen in children, and it usually occurs right from when the child is within the mother's womb. And it usually occurs when the face is forming at about 10 to 12 weeks. And the lips don't form properly, and then inside the mouth, the palate doesn't form properly. So what you would see outwardly is a child with a lip that is not continuous. There will be a gap in the face, or there will be a gap extending from the lip right into the nose. And when you open the child's mouth, you will see a gap in the roof of the mouth, which we call the palate. It can occur in isolation, or it can occur together with, as you said, other genetic anomalies. And we want parents and anyone that has knowledge of this kind of conditions to know that these conditions are not life-threatening. And it's not as a result of what the mother did or what the mother did not do, the antenatal she skipped, or the drugs she did not take. These are conditions that do not affect the quality of life of that child. What is needed is that child should be taken to the hospital, because the corrective surgeries for this condition is readily available throughout the country, so that it will be attended to before the child starts speaking, because this condition is associated with a number of problems. Because it's the mouth and it's a newborn, of course they have to feed to grow. So feeding is an initial problem, because the lip is not continuous, the child cannot latch onto the mother's breast. So feeding is a problem, and if left, they will come down with malnutrition. Because of that gap in the leading to the nose or on the roof of the mouth, they could come down with ear infections, eye infections, because there's abnormal communication with the eustachian tube, and then they could come down with these conditions that could even lead to hearing loss. And we all know, you see a child with a face that is not properly formed. Of course, psychological, the parents are already down, the community, everybody will be wondering, is this an Obanje child, is this? So there is the psychological component. And when they grow up, because of the configuration of the face, they won't be able to talk properly. So they will have something like a nasal speech, and they won't be able to pronounce words properly. So we need them to come in for treatment early. And then if it's also not corrected, the teeth cannot be aligned properly. So they will come with mal-alignment of the teeth, and then even occlusion of the mouth. So these are some of the problems that could come with this condition.
There seems to be quite a lot associated with the cleft palate condition. But you mentioned that it's not as a result of what the mother is doing or something. Is the condition entirely genetic? Is it as a result of maybe the genes of the parents? Is it hereditary, that kind of thing?
Well, it has two components. It could be genetic, but the larger number is not genetic. Although it is linked to alcohol use in the mother, smoking, and then use of some drugs. But largely in our society, we feel that it has to do with some sort of spiritual problem, which we want people to know that this is not a spiritual problem. Even though if genetic, it can be corrected and the child can live a near normal life. Normal life. All the child might have is just a scar. But if treated early, speech therapy started early, orthodontic treatment started, the child started early, the child can live a normal life, even though the child was given birth with this condition. So in general, we would, of course, generally smoking and alcohol use, definitely in pregnant women, is not advised. But in general terms, it's most patients don't have these risk factors.
I would like to know the prevalence of cleft lip in Nigeria. How common is it?
It's quite a common condition. From the data from WHO, we have about 6,180 children born every year with cleft lip and or palate in Nigeria, and about 540 children born every day with this condition. So I would say it's quite a common condition.
Okay.
Given how common it is, how accessible is treatment? How often do we see people coming in to get treated for cleft palates?
Across the country, back in years back, well, we didn't have a lot of patients that would come because there's so much stigma attached to this condition. But across the nation, there are free services, free treatment, comprehensive holistic treatment for these children that are offered in 33 states of Nigeria. There are 3 states that don't have cleft services, but offered in 33 states free. Although they are also offered in almost any teaching hospital. But there's an organization called the Smile Train that has been in Nigeria since about 2002 that offer free comprehensive care to these patients wherever you are. Even if you are in the 3 states that do not have these services, that's Adamawa, Benue, and Taraba, there is some form of stipend or transport that are given to these patients to be able to access these services free of charge. Right down to the nutritional support is given, so that across the nation we don't have children that aren't able to smile, because the whole aim is to make every child able to smile, because if your lip is deformed, of course you won't be able to smile.
Could you explain the importance of early intervention in cleft treatment?
Yes. As I said earlier, these children, right from the newborn, if they have the cleft lip, they aren't able to feed, to latch on to the mother's breast. So sucking is a problem. They won't be able to suck directly. So they need to come to the hospital so that we teach them how to feed. There are special bottles that we can use as even for the cleft, the ones that have the gap in the roof of the mouth. There are special things we do. There are special bottles we give to them that have long feeding. The spoon is quite long that bypasses that defect and the child can feed. We give nutritional advice. That's why I said it's a holistic treatment. So we cover nutrition. Then, as I said earlier, they could come down with conjunctivitis, ear infections. So that's why they need to present early, so that we actively manage these conditions, that they don't come down with complications. And also, they need to come before the teeth erupts. Because if not, if there's a defect along the gum line, then the teeth will be malarranged. They won't erupt properly, and there will be some malocclusion. So for these reasons and more, parents with these children, and we even see adults, lots of adults that have unfortunately not been able to access care early on. These services are open to any patient, whether it be a child or it be an adult that has this condition. It's never too late. At least something can be done to correct these deformities.
Okay, given that you say this can be discovered, during the anomaly scan that pregnant women carry out while they are still pregnant, before they give birth, is it possible that when you spot the anomaly during pregnancy, it's treated, or you can just do something about it before the person gives birth?
These conditions occur while the child is in utero and while the development of the face is ongoing. Might not be easily picked, but even though picked, the treatment would be after the child is born. There are really no in utero treatments for this child because, as I said, it's not life-threatening. So the life of the child is not at risk. And then what we offer is reconstructive surgery. So it's not offered immediately the child is born. Of course, a neonate is fragile, is tender, would want to give some time, address nutritional issues, and before we do the reconstructive surgery. So that's why I need to come in early so that we can teach you how to feed these children.
Okay, so how can individuals, organizations, health centers, how can they raise awareness now concerning, cleft treatment? Because you said there's a stigma to it, generally speaking, in the society today. So how can we raise awareness so that people know that this is just a health condition and they should come to the hospital for treatment?
Okay, thank you. And thank you for this platform. I think this is an excellent opportunity because I'm sure a lot of Nigerians watch this program, and word of mouth it's quite important. So this is one of the avenues that we try to educate people across the country to know that this condition is just like any condition. It's like having malaria and you have to go for treatment. So it's not a spiritual problem. Children, right up till today, we have children that are being killed. I have had children within this year, 2 children, one little baby that we were planning for surgery, and the mother said they went to the village to visit the relatives, and the child suddenly died. There was also another one like that was supposed to come for surgery, but just with seeing the child in the clinic, child was doing well, but they said the child suddenly died. So we don't want these cases that parents will feel these children portend bad luck, bring bad omen, or some sort of spiritual issues. No, they are diseases that have treatment. So, and these services are provided nationwide across all the states free of charge. This is to make people easily access these services. And we have a number of patients that have accessed this service. These services have been in Nigeria for long, since 2002. So we have had thousands of patients that have had these services, and it has dramatically improved their life. Recently, we had a married lady whose husband brought her for treatment. So recently, we even did an 18-year-old had completed WAEC, couldn't talk properly, and she has had her surgery and is starting speech therapy. So we want people to know that these are correctable conditions. There is a solution to these problems.
Okay, what challenges would you say that you have faced in trying to provide this treatment, particularly in terms of getting patients to come on board, and what would you like to say to them?
Well, our major challenge is that those in the hinterland, in the villages, don't know about these services. And within the city, of course, a lot of people are enlightened and they know about hospitals. But right deep into the hinterlands, that people don't have access to TV, smartphones, I think that's a major challenge. But there has been a drive going to different radio stations, TV stations, and letting people know, so that by word of mouth, this information can be carried right into the villages. And sometimes we do outreaches right into the markets, into the deep villages, just to let people know. Because one major challenge is the cost of surgery for these patients. It's not a one-off treatment. So you have to come in for surgery. You might need to have surgery in stages. You might need to come in for speech therapy so that your speech is improved. So it's a lot of cost for our people. And that's why this organization, Smile Train, is providing these services free of charge for our people, so that we'll be children with these conditions will be able to access these services. And then another thing is stigma. Stigma, and then people feel that it's a spiritual problem. So even our spiritual houses, they could also spread the word that this condition is treatable. And I think those are the major challenges we have.
All right. Thank you so much, Dr. Salamatu, for joining us and shedding light on cleft treatment in Nigeria. If you or anyone you know has cleft lip, please, it is treatable, and there are solutions at your health centers and hospitals. Do not go on, doing your own thing and focusing on the stigma, but please focus on the treatment and the surgery made available. Dr. Salamatu, how can they reach you?
Okay. There is a toll-free line across the nation. Wherever you are, you can call. Wherever you are, you can call this number, and you will be directed to the nearest Smile Train center. And the number is 080 076 45 364. I'll take the number again, 080 076 45 364. And then for anyone within Abuja, the number to reach is 0912 288 5239. 0912 288 5239. For anyone within Abuja and its environs, that's Benue, Nasarawa, Lokoja axis.
Thank you so much.
Thank you so
Dr.
much.
Salamatu.
Yes, amazing work that you're doing, and
Absolutely.
the Smile Train team also. That's very amazing.
Yeah.
Thank you for having me. It's a pleasure.
Yes, it was wonderful speaking to you. Thank you. Okay, and that's it for the lifestyle segment. We have so much more coming up on the weekend show.